Distinguished future physicians, welcome to Stomp on Step 1, the only free video series that helps you study more efficiently by focusing on the highest yield material. This is the fourth video in the psychiatry section, and it is going to cover malingering, somatization, factitious disorders, and a few other related disorders. This is a group of illnesses where the patient reports symptoms that have no medical explanation. The patient may be deliberately misleading the physician or unaware that their complaints have no identifiable cause. Each of these is a diagnosis of exclusion. Providers should not jump to the conclusion that a patient is faking it unless there's sufficient evidence to suggest that, because you could potentially miss what is really causing the patient's symptoms. Even hypochondriacs and drug seekers really do get sick. So even a previous history of one of these disorders should not automatically lead to a diagnosis. However, physicians must also avoid prescribing unnecessary treatments and diagnostic tests in these patients. Possible treatments for these disorders include scheduling periodic office visits to discuss the patient's concerns, referral for therapy, or management of current stressors that could be contributing to the problem. We will start with malingering, which you can see here in the top right corner. I gave a high yield rating of 1. For those of you who aren't familiar with the high yield rating, it is a scale from 0 to 10, which gives you an estimate for how important each topic is for the USMLE Step 1 Medical Board exam. It is based on a number of factors, including how frequently that topic appears in retired Step 1 questions. To learn more about the high yield rating, you can click on the orange box here. So malingering is when a psychiatrically healthy patient is intentionally fabricating or exaggerating symptoms for personal gain. After getting what they want, which is sometimes called an external or secondary gain, the symptoms disappear. The symptoms may also be absent when the doctor isn't in the room, but become unbearable as soon as the patient has an audience. They are generally unwilling to undergo potentially harmful or painful tests and treatments. They may become irritable when providers question their symptoms. This isn't really a psychiatric condition because these people are acting logically in order to get something valuable or get out of doing something they really don't want to do. Here are some examples for why a patient would malinger: obtaining narcotics, legal compensation, getting disability payments, getting a lesser criminal sentence, or trying to get out of school, work, or military duty. Factitious disorder is when a psychiatrically unwell patient is consciously fabricating or exaggerating symptoms to get attention or sympathy from medical providers, friends, or family. The benefits these patients seek from playing the sick role is sometimes referred to as internal or primary gain. These patients are often willing to undergo potentially harmful or painful treatments and tests. Munchausen syndrome is a now outdated term for a severe chronic form of this factitious disorder. Factitious disorder by proxy is when a person fakes symptoms in a person they care for in order to get attention or sympathy. This usually involves an adult patient who is caring for a child or an elderly patient. Somatization disorder is a type of somatoform disorder, where a psychiatrically unwell patient unconsciously fabricates symptoms. Their symptoms have no physical cause, but they are not aware of that. They perceive their symptoms as being real and are not deliberately creating these symptoms. They will have multiple vague complaints across various organ systems. In the latest version of the Diagnostics and Statistical Manual, which is sort of like the official encyclopedia which defines psychiatric terms, somatization has been renamed somatic symptom disorder. They also got rid of the term hypochondriasis. Most of the people previously diagnosed with hypochondriasis would now be classified as having illness anxiety disorder. However, you don't have to worry about these recent changes in DSM-5 because it takes many years for the exam to get updated. You will most likely see the old names on the exam. Conversion disorder is an extreme type of somatization that results in the patient suddenly losing voluntary motor and/or sensory functions during a time of stress. For example, the patient will suddenly have paralysis, blindness, or paresthesia. It looks like a stroke, but it isn't. It is usually triggered by stress, and most patients spontaneously recover. Oddly, many of these patients are not very concerned about their symptoms. Here's a table summarizing the key points of what we have covered so far in this video. If you'd like to look it over, you can pause the video or go to my website to download it. That brings us to the end of this video. If you found it useful and want to help me out, you can click on this orange box right here to subscribe to my YouTube channel. The next video in the psych section is going to cover eating disorders. That includes bulimia, anorexia nervosa, as well as some related topics like binge eating disorder. To view that video, you can click on the black box here to be taken directly to it. Thank you for watching, and good luck with the rest of your studying.